Major Debbie Strydom from the Cardiac Rehab Clinic, working in biokinetics of One Military Hospital. Well, September is Heart Month, International Heart Month, and we want to create an awareness for heart disease because it's the #1 killer of human race currently still. At One Military Hospital, we have a Heart Week, the last week in September, from the 26th to the 30th of September. It's important to us to create an awareness amongst people for heart disease. There are several risk factors that can lead to a heart problem, but the good news is there are several risk factors that you actually can do something about. If you know what your cholesterol levels are and you know your glucose levels, you can stop smoking, be more active, reduce your stress levels, then you also can reduce your risk of developing coronary artery disease. If in the unfortunate event, if you do suffer from a cardiac event and they did a cardiac procedure, they will refer you to the biokinetic center where my colleague, Captain Goeieman, who's with me on the cardiac rehab clinic, will start with second phase cardiac rehab. That is where we monitor the patients closely with ECG, that we can see what the heart does while they exercise to make sure they exercise in a safe condition. Don't overdo it, but do exercise the heart sufficiently. We monitor the blood pressure as well, and then that happens for 2 to 6 weeks, 2 to 3 times a week, depending on the patient's availability. And after the second phase, if everything is going well, they move over to the gym where they exercise in a group, and then they start with third phase cardiac rehab. We still monitor the heart rate and we monitor the blood pressure weekly, but they exercise in a group, do cardiovascular exercise, walking, cycling, we do an arm ergometer, and they do light resistance training.
Health Warriors, serving the brave.